Good afternoon. I feel like I have big shoes to fill because we had such a great presentation all during the day as well as last night. Like Carolyn said, my name is Fran Talsma, and I am the Research Policy Advocate for MICHR. And in addition to my work for MICHR, I also work for the YMCA of the state of Michigan, leading a childhood obesity effort throughout the state. Through my work at MICHR, I have the pleasure of working with several of our community partners. And today, Amanda Edmonds will be joining us to share her policy story. I've really found that when I do advocacy and policy work, it's best to be able to share a story. So we invited Amanda here to do that. During our presentation, this just gives you an idea of what you have in store for you for the next 50 minutes. We will give you a brief description of what the MICHR Community Engagement Community Coordinating Council does, and more importantly, our commitment to policy work. And then we'll shift to the main event, which is the success of Growing Hope, how a grassroots community-based organization with strong leadership, strong partnerships, and good data can impact the landscape of the food delivery system for the entire state. By way of clarification, in the legislative arena, sometimes lobbying and advocacy are interchanged, and advocacy, oftentimes with my work in the state and in DC, means something different than what advocacy means within the MICHR community. So you'll see me kind of go back and forth with that language. Lobbying is bill-specific advocacy or influencing, where advocates really position themselves as information sharers and resources to lawmakers. So to be an advocate within the legislative process allows you to influence policy and have great impact on the work. So for those of you who are in the community, and I'm often asked, what is the MICHR Community Engagement Coordinating Council? And my response is, we are a small part of MICHR, but we are mighty. This is to give you the big picture. And for those of you who were lucky enough to be here last night, Dr. Shanley, I think, also showed this slide. But the Community Engagement Program is part of our OPUS, one of our OPUS program key areas. And OPUS stands for Outreach, Partnerships, Implementation Services. Sciences. The social worker in me always thinks services. There are a lot of acronyms in the MICHR world, and it's often difficult for me to keep up with them. I don't know if it's that I'm well stationed in middle age or that I'm multitasking all the time, but it's hard for me to keep up with the names. Although our names might change periodically, our mission remains the same, and that's a commitment to good community partners. I joined MICHR in 2009, and we really, at that point, decided to have a policy focus to our work. So, what the Coordinating Council is. Our council strives to bring diverse members to the table, and we aim to achieve cultural, organizational, and geographic diversity. So currently we have representation from the Flint community, Detroit community, and the Ann Arbor Ypsilanti community. We also have some wonderful group of university participation, and I'd like to, if those of you who are part of our Community Engagement Coordinating Council, if you could stand up. I see two of our partners there, so you guys have to stand up. So thank you very much. So, and Karen, right. So in the spirit of growth and change that I referred to earlier, the Coordinating Council recently underwent a kind of a change in, we adopted a co-facilitator role. We were led by university staff. And at our last meeting, Karen Calhoun, who's seated in the front row, joined us alongside Dr. Sam Sell as our leader and co-facilitator of the Coordinating Council. In short, our council walks the talk. And through this restructuring, our faculty and university partners actually stepped away from the table, and it was the community partners that really developed the structure of what we wanted, how we wanted compensation for that role, and we presented it to the university partners, and it was approved unanimously. And the goal of our council is to foster research partnerships by identifying community health priorities, building community capacity to conduct research, and most importantly, to disseminate the research findings to actually result in better health for the community. So many of you have been hearing about the pilot grant program through the Coordinating Council, and Amanda actually was one of the Growing Hope received one of these pilot grants. So I'll briefly describe that. Our council does a lot of great work, and our agendas are packed. But one of the best things we get to do, or the most rewarding things, is we get to give money away. If you were lucky enough to be here last night, you heard that we've given away $300,000 in pilot grants to date, $25,000 grants. And our goal is to identify the pilots that represent true partnerships between the university and the community. To that end, we developed a screen, and we really looked to the Scientific Review Committee and looked at how they evaluated pilots, and we adopted that framework, but from a community angle. So the questions we ask ourselves, or the screen that we place on every pilot application, and this is important if you're considering submitting a pilot, is that we look for the viability of the community organization. And this is where our community advocates really come in handy, because they know who the real players are in the community, they know the viability of the organization. We ask, are they asking a real research question? Is it a question that they have the ability to answer? The fairness of the partnership, like we just heard in the last presentation, and also if the research is responding to a true community need. Is the pilot likely to end up with getting further research funding? How will the information be shared? And the notion of a community benefit, which I know that was mentioned earlier today, but that's something that really drives our work. So we apply this screen to every decision we make about whether or not to recommend a pilot for funding. If you are considering applying for pilot funding, I encourage you to do so, to reach out to our community engagement group. Tricia Pachowski here is the person to talk to, and she really can help guide you through the process. And these are just a few examples of our partnerships that we currently have going. How many partners have we had in all, Tricia? I'm not sure.
Oh, funded?
13. So this is 3 of the 13, the 3 that I had images for. So like I said, I am a policy advocate. So when community engagement looked to have a policy focus, we realized that information sharing within the university or within the community was important, but also information sharing to key policy leaders and to the larger stakeholders was critical to our work. Our first step that we did was to identify trends and potential connections between our community engagement pilots as well as policymakers. So we partnered with the Washtenaw County Health Department and the Washtenaw County Health Improvement Plan to develop a simple advocacy policy roadmap that would help lead people to do policy work and to integrate policy work into their pilots. And we actually have the poster that we presented at the American Public Health Association is out in one of the ante-rooms if you'd like to look at it. So from that, we really continued to progress. And last week, I actually testified in Lansing alongside another one of our community partners, Dr. Wolford from Mott Children's Hospital, about childhood obesity in Michigan. And Dr. Wolford was one of our first pilot awardees, and she partners with the Ann Arbor YMCA right here. Obesity is a very hot topic in our state right now, and it's one of the 2 health-related topics on the governor's dashboard, which I don't know how many of you have seen Governor Snyder's dashboard, but he identified 2 health factors that he wants to have an impact on. Obesity is one of them, and the other one is infant mortality. In addition, Olga Dazo, who is the director of the Michigan Department of Community Health and who really holds the purse strings as well as some of the legislative priorities in the state around health, identified obesity as the #1 health threat facing the state of Michigan. They've developed a statewide task force. We were invited to join. They are hungry for data. They would love research in this area because they want to make informed decisions that are data related. So, when thinking about how to do policy work in your own organization, these are the things I would recommend. It's important to integrate policy into every phase of your work. That doesn't mean you have to become policy people 24/7. That's kind of my job. But to think about your work as being policy driven, to think about how can I translate my work not only to the people that I'm serving, the people that I'm working with, but people who might actually not be that interested in your work, but can have an impact on your work if properly persuaded. Realize it's really important to develop a consistent message. but have the flexibility to tailor your message to a specific audience. And that is the beauty of the MICHR partnerships, because you do bring diverse groups to the table. So even though you can have a shared common message or a shared common goal, you have the flexibility of your messengers to deliver the appropriate message or have the appropriate language to talk to any specific populations. Oftentimes, we're very good at talking with each other, and it's really important that we have the tools to communicate with people on all different levels. So, Growing Hope. Growing Hope is a living example of a grassroots community organization that started out as a seed and has grown well beyond the garden. MICHR is proud of its partnership with Growing Hope, and I am awed by Amanda's dedication and her boundless energy. I've asked Amanda to come today to share their story, how Growing Hope leveraged community assets as well as grew effective partnerships and really had an impact on the state for years to come. So here's Amanda and her story.
Thanks, Fran.
You're welcome, Amanda. There you go.
Okay, looks like we have about 30 minutes. Is that right?
So that's
Timekeepers? Okay, yeah. Yeah, that's like 2,000 words a minute that I speak, so I can get a lot in that time. First, a couple shout outs. In the audience, we have Sharon Sheldon. Raise your hand, Sharon, up there, who was one of our founding board members in 2003 and just finished her a billionth term on the board, having served actually 5 years as our board president. And Sharon works for the Washtenaw County Public Health Department and is dedicated to obesity prevention and prevention in general of chronic disease. And she's been both a key ally, a key member of the Growing Hope community, and still is, even though she's not on the board any longer, as well as a key partner through many partnerships we've had for many years in the Washtenaw and continue to have with the Washtenaw County Public Health Department.